Welcome to this video. If you've already watched other videos in my channel, I'm also trying to start this new format, and I'm going to try to intersperse some brief reports on recent papers amongst my more edition-heavy videos. So I'm trying to keep this brief. We've recently, on April 16th, had a paper published on JAMA Internal Medicine, which is the most viewed so far in the last 30 days, with 46,554 views, titled Fitted Filtration Efficiency of Double Masking During the COVID-19 Pandemic. A research letter authored by Sickbert-Bennett, Samet, Prince et al. According to Google Trends, people have been extremely interested in masks, and there have been recent reports on news outlets about double masking, such as Explica.co that published There's a Right Way and a Wrong Way to Wear a Double Mask, and Business Insider India, which published Double Masks for COVID-19, How to Wear Them, and Other Things You Should Know. So, before anything else, a disclaimer: this is not medical advice. Even though I am a physician, I could be wrong, this study could be wrong, I'm merely reporting on it. So, before you make any decision based on this information, please read the study yourself and or consult with your physician if you are not one. So, this study by Sickbert-Bennett mentions that US public health officials have encouraged double masking to prevent SARS-CoV-2 infection, and that the US CDC has reported increased effectiveness on using two masks one over the other. So in this study, they've decided to measure the fitted filtration efficiency of multiple combinations of masks to see, first, if it works, if they reach the same conclusion of the CDC, and second, which combination is best. Then they explained that this fitted filtration efficiency, or FFE, is based on the concentration of particles behind the mask compared to the percentage of particles in front of the mask in the, they say, sodium chloride particle enriched chamber atmosphere. That is, what percentage of particles can actually cross the mask after a series of procedural movements. They used one female volunteer and two male volunteers, all with shaven faces. So they measured the percentage of particles that could get across each of these masks and came to some conclusions. They produced this table with the results, and here they mean, and you can see clearly, that the procedure masks showed greater efficiency than the cloth masks. Makes sense, they are professional grade, actually designed for healthcare professionals. And they mention pretty clearly that, quote, adding a second procedure mask improved mean between parentheses standard deviation fitted filtration efficiency from 55% standard deviation 11% when single masking to 66% mean 12% standard deviation when double masking, end quote. Now, of course, it would be better if they had a larger sample, more than 3 volunteers, to bring down the standard deviation and make the results more accurate, but at least the results are consistent with what we would expect, that professional-grade procedure masks are more efficient than cloth masks, and that wearing more than one barrier is going to make it harder for particles to cross across both of them than just one of them. They also mentioned that, quote, doubling cotton mask improved FFE but could reduce breathability, end quote. Yeah, that makes sense. I believe everyone has anecdotal evidence that someone has said at the very least that breathing through a cotton mask is harder than through a normal conventional standard procedure mask. And so here in the table they've divided the face mask by the manufacturer, and they've divided the cloth masks by the material. And they've said then that, quote, although adding a procedure mask over the cloth masks provided modest increases in their FFE, the overall performance was no different than wearing the procedure mask by itself, end quote. Meaning that, according to this study, there would be no advantage to wearing the procedure mask over any other kind of masks other than another procedure mask at all. However, quote, wearing a procedure mask under the cloth face covering produced marked improvements in overall FFE, end quote. And yes, what we can clearly see here in the table is that wearing the procedural mask under whichever other kind of mask you are going to wear is way better than wearing it over, which they're going to tie into the discussion. But from this table, ignoring the statistical significance here, because it would be greater to have a larger sample undoubtedly. But what we can infer looking here is that using a double mask is better than using a single mask, and that you should always wear the procedural mask under whichever other kind of mask you're going to use. Otherwise, there is pretty much no advantage at all, at least not a noticeable one. And there, in the discussion, they mentioned, quote, in fact, it's notable that enhancements that improve the seal between the mask and the facial skin dramatically improved FFE performance, suggesting that fit, not material, is the intrinsic limiting factor for procedural masks. And then they elaborate on it by saying, quote, the improvement in the FFE of procedural masks when doubled or when worn underneath reusable cloth face coverings is consistent with minimizing leaks between the mask and facial skin, including the bridge of the nose, end quote, which would make all the sense with their findings that wearing the procedural mask over the cloth masks adds very little benefit, if any at all. We can deduce from their conclusions that the benefit from wearing double masks is first because the second mask overlying the first improves its fit and minimizes leaks, rather than because the presence of two subsequent barriers is decreasing the amount of particles going across the masks. Most likely, the greater benefit is coming from reduced leaks, not exactly from improved filtration. Overall, a small study, but an interesting one in guiding the use of masks and showing the exact mechanisms that helps in double masking.